Hi, my name's Jennifer and I am a licensed veterinary technician. I work at a 24-hour emergency clinic here in Virginia Beach called Acredale Animal Hospital, and I've been a technician there for almost 7 years now. I chose this career because I've always loved being around animals, and when it came time for me to start looking into what career path I wanted to take, I knew it had to involve them. So after I graduated high school, I went to a college called Tri-County Technical College in Clemson, South Carolina, and it was there that I discovered the field of veterinary technology. So there's a couple ways to get your veterinary technology degree. I went to a college that was a 2-year program. We went 5 days a week for fall and spring. And then in the summertime, we had an internship that we had to get a certain amount of skills done at any clinic. Around here, a lot of my colleagues do online classes since there's really no school local here. They would go to TCC for their prereq classes, and then they would communicate with their teachers online, and they would make videos at work showing their skills and what they've learned. You also have to take a boards examination once you've completed your accredited veterinary technician program. So when I moved back home after college, I had to take a national board exam here over everything I've learned the past 2.5 years. And once you've passed that, then you can be licensed and work. So one of the neat things that I got to do at my school was that we were assigned animals from the local shelters every semester, usually one cat and one dog. And we would do spay and neuter surgeries on them. We would get them started on their vaccines, make sure they didn't have any worms. We would train them. We would also practice our procedures that we would have to know, like blood draws. And at the end of each semester, we held adoptions for them. I actually ended up adopting my dog that was assigned to me, and this is Oreo. Come here. So he, and that's Dottie too, because there can't be one without the other. And that's what happens a lot in this field. You end up coming home sometimes with your work. So Oreo was one of my dogs I just couldn't do without. And then the next year I got Dottie, and she was a rescue as well. She was, come here. She was left at a shelter in a box when she was about 6 weeks old. And so we adopted her to be friends with Oreo. So a typical day when I go to the clinic is I usually go in about 7 o'clock in the morning, and that's when my shift starts, and we do medications for all the pets there that need their morning meds. We have boarding animals that sometimes need it. They're either diabetics or they're older and they need just their medicine for heart conditions or joint problems, that type thing. And then we also have hospitalized pets too that need medications as well. So a lot of times that's the very first thing I do when I come in the morning. We do all our medications, we check heart rates, we weigh pets, we do temperatures, all that stuff to make sure to see how they're doing. And then after that, we see pets that are being dropped off for special testing. Sometimes they just come in for blood work. Heartworm tests is a lot of times we're checking to make sure they don't have heartworms, which is really prevalent in our area. We do vaccines. They're either coming in to see the doctor for an annual checkup, and so they'll get their annual vaccines then, or sometimes they've already seen the doctor but they just need a booster shot. Some traits and skills that are needed in this field is, number one, compassion. We don't get to see a lot of puppies and kittens all the time. We deal with a lot of sick pets. They don't understand that what we are doing is to help them and not hurt them. We have to be very careful that they and we stay safe. And compassion is extremely important, because even though the patient is trying to get away from us, we have to stay calm, have sympathy for them. We know that they don't understand, they're in pain. We have to do the best that we can to help them. Another big part of my job is client education. And if we aren't kind and understanding with the owners, then most likely they're not going to listen to us and give their pet the help that they need the right way. Some other skills that are needed to be a technician are some of your basic skills like science. Biology is very important in this field. We also use a lot of math. Math is probably one of the most important ones, because we are constantly calculating drug doses for medications or anesthesia, and just the simple misplacement of a decimal can mean big trouble for our pets. Some other skills that we are specifically taught is one is venipuncture, which is drawing blood. We do a lot of that for running labs. Pharmacology is another one. We need to know about the different types of drugs, what classes they're in, make sure they don't interact with any of the medications that the pet is on. Another trait is anesthesia. We perform anesthesia on animals. Even for dentals, they need to be asleep so we can clean their teeth properly, which is really important. A lot more people are taking their animals to get their teeth clean, which we do the cleaning just like an oral hygienist does for our teeth. We're doing the cleaning for animals, but they have to be asleep so we can open their mouth safely and clean it properly. We're also taking x-rays in the mouth so they can't bite down on that sensor. We also do lab procedures. We run urinalysis to make sure the urine looks okay, blood work, that type of thing. We're looking at if they come in with ear infections, we have to look at that underneath microscopes. We have to also, with pets, you have to monitor their feces, which is one of the more unpleasant things of our job, but one of the most important things, because if they have any type of intestinal parasites, we have to know them, we have to treat it, or they can get really, really sick. We see it a lot of times with puppies. If you've ever seen a puppy and they're really cute and they've got this really cute little belly, most likely it's full of worms. So we always deworm those puppies so they're really, really cute and they aren't filled with worms. So a couple things that we can't do is we cannot perform surgery. We can assist the doctor, give them the tools that they need. I'm running the anesthesia usually when they are doing the surgical procedure, and we can help suture up afterwards, but we are not allowed to perform the surgery. Second thing is that we cannot make diagnosis. We help them with their diagnosis by running the tests that we need to run so they have the answers. Third is we cannot prescribe medications. One of my favorite things I would have to say is when a pet gets to go home. Since we are an emergency clinic now, we still get to see healthy pets that are in just for regular annual checkups, but we do see a fair amount of sick pets. Them going home feeling good, their owners are extremely excited to have them back. It feels good to know that you've really helped a life. There are some challenges with my job. I would say probably one of the most challenging things would have to do with restraint. Like I said before, they don't know that we're there to help them, and sometimes they're just really scared. They could be hurt. That's why they're acting the way they are, or they're just scared. They're not at home, they're not with their owner, they don't know who we are, and so we have to be really careful that we are holding them properly so we can get done what we need to do, either x-rays or if we have to do lab work. We have to make sure that not only they stay safe so they don't get hurt, but we stay safe as well. So what kind of money can you make as a veterinary technician? You can probably expect around $30,000 to $40,000 probably annually. A lot of the technicians I work with. They work a lot of overtime hours. Some of them are actually specialized in other things, and so that increases your pay as well. But generally speaking, it's probably like $15 to $20 an hour. So we are underpaid, unfortunately, but most of us do it because we love it. We love helping animals. Some people work for the Humane Society, and so they deal with a lot more rescuing and then adoptions. So there's different types of places to work in a veterinary technician field, but generally speaking, it's probably around 30 to 40,000. So thank you for letting me talk about my field. Oh my goodness. If anybody is interested in working with these guys, I always recommend that you go to a veterinary clinic locally and ask to either volunteer. You can actually shadow people who work there and just kind of see what they do, see if it's something that you really want to pursue, because it is, when you really love these guys, it is extremely rewarding. And yeah, so thanks a lot. Talk to you later. Bye.